Hi guys, this is Ma'am Yan. Today, let's do a ratio of your most requested topic and that's your ABG. Guys, sige, simulan na natin. Number 1, Albedo, a 54-year-old widower with a history of COPD, is brought to the emergency room due to worsening dyspnea, fever, productive yellow-green sputum. He struggles to complete sentences and his son, Kaya, shares that he's been ill for 3 days. Crackles and wheezes are audible in the lower lobes. His pulse is bounding and tachycardic. ABG results, you have pH 7.3, partial pressure of carbon dioxide 68. Your bicarb is 28 and your partial pressure of oxygen is 60. How should this be interpreted? A. Respiratory acidosis uncompensated. Or B. Respiratory acidosis partially compensated. Or C. Metabolic alkalosis uncompensated. Or D. Metabolic acidosis partially compensated. Oh guys, the only correct answer is no other than bravo. This is a acidosis na partially compensated. Guys, let's look at the pH. 7.3. Is that acid or alka? Malamang that's acidosis. Acidic yan guys kasi the normal pH o ang normal pH mo dapat 7.35 to 7.45. Less than 7.35, you get an acidic pH. More than 7.45, you get an alka. The lower the value of the pH, the more acidic it is. The higher the value of the pH, the more alkalinic it is. Malinaw? Yes. Now, the next thing we look at is the value of your partial pressure of carbon dioxide and your bicarbonate. Guys, your partial pressure of carbon dioxide is 68. Guys, is that acidic or alka? Malamang, acidic yan. AC, acidic yan. Kasi ano ang normal, guys, ng iyong carbon dioxide, partial pressure of your carbon dioxide? The normal should be 35 to 45. Ibaba mo lang ang dalawang to. That's the normal value of your partial pressure of the carbon dioxide. Now, this is what I want you to know, guys. Carbon dioxide, in and of itself, is a gas. Gas yan, just like your oxygen. Kaya, ang carbon dioxide, respi in nature. And aside from that being a gas and respiratory in nature, it's always gonna be an acidic compound in the body. So, ibig sabihin, the higher the value of an acidic content, edi mas acidic ka, correct? So, guys, acidosis yan kapag more than 45. And guys, pag nauubos ang acid mo sa katawan, edi nagiging alkalinic ka, malinaw? Yes, ayan. So, yan. O, di ba? So, now, you have two acidosis in the pH and the partial pressure of your carbon dioxide. So, sila yung pares. Ibig sabihin, respiratory acidosis to. Because again, carbon dioxide is acidic in nature and a gas, making it a respiratory cause. Tama? Yes, of the acidosis of the pH kasi less than 7.35. Correct? Yes. So, that's your respiratory acidosis. Now, how did we get the word partially compensated? Kasi tingnan mo ang value ng bicarb mo. Ang value ng bicarb mo is 28. Guys, ang normal na bicarb, it should be 22 to 26. And bicarb in and of itself is really alkalinic in nature. So, ibig sabihin kung alkalinic siya, pag tumataas ang value ng bicarb mo, the body is becoming more alka. And pag nauubos ang alka content ng katawan mo, ibig sabihin, nagiging acidotic ka. Malinaw? Yes. Anong nangyari sa bicarb mo dito, guys? Tumaas ba? Naging 28? Yes. So, is that alkalinic? Yes. So, guys, may opposite ka. This one, nagiging alkalinic ang 28 mo. So, guys, kung nagiging alkalinic ang bicarb mo, which is the compound that goes against your carbon dioxide or your acidic compound in the body. Ibig sabihin, tinatry niya mag-compensate kasi tumataas siya. Mas ginagawa niyang alkalinic ang katawan. So that's why you get a partially compensated answer rather than uncompensated. Uncompensated yan if the bicarb remains normal. And that will be completely compensated if ang pH mo normal, 7.35 to 7.45. Anong pH mo? 7.3 lang. Ibig sabihin, acidic siya. Hindi siya within the normal range of 7.35 to 7.45. And nag-compensate naman ang bicarb mo kasi tumaas siya to become alkalinic in nature. But despite the compensation, the pH is still not in the normal range. That's why you call it partially compensated lang. Malinaw? Yes. And definitely not metabolic in nature kasi ang tumaas at nagpera sa pH mo is no other than your gas, your carbon dioxide. So that's respite in nature. That's why the best answer for number 1 is Bravo. Next, number 2. Klee, an elementary student, is rushed to the ER after vomiting and altered consciousness. She is lethargic and irritable with deep respiration. Nagka-cosmos breathing siya, sunken eyes, and dry mucosa. Her mother says she's had polyuria, polydipsia, and weight loss for 2 weeks. ABG results is 7.0. Partial pressure of oxygen is 90. Partial pressure of carbon dioxide is 23. And your bicarbonate is 12. Your sodium is 126. Your potassium is 5. Your chloride is 95. Wow, binigay pa ang yung electrolytes. What's your interpretation? A, is it a respiratory acidosis uncompensated? Or B, respiratory acidosis na partially compensated? Or C, metabolic alkalosis uncompensated? Or D, metabolic acidosis na partially compensated? The pH is acidic. So, eliminate mo lahat ng alkalosis. The next thing you look at is kung kanino siya nag-prepare. pH is acidic. Tingnan natin ang partial pressure ng carbon dioxide. Guys, 23. Nauubos ang kanyang carbon dioxide. Nauubos ang acidic na gas. Kasi the normal should be 35 to 45. Kung nauubos ang acidic content ng katawan, nagiging alka. Correct? Yan. So, hindi sila pair. Malinaw? Yes. Ngayon, tignan natin ang bicarbonate mo. 12. Guys, bicarbonate is that in and of itself, alkalinic talaga. Yes. So, guys, pag nauubos ang alka sa katawan, nagiging acidic ba? Yes. So, ibig sabihin, guys, ang iyong bicarbonate is acidic kasi naging 12. The normal should be 22 to 26. Correct? Yes. Now, you have metabolic na acidosis. San dyan? Isa na lang ang natitira and that's delta. That's why delta is the correct answer. It's a metabolic acidosis kasi pH is partnered with your alkalinic content which is your bicarbonate. And bicarbonate is metabolic in nature. Kasi sino ang nag-aalaga sa bicarb mo, guys? Kidneys mo. Okay? Kidneys mo nagre-regulate niyan. As compared to your gas, like your carbon dioxide, that's respiratory in nature. So guys, kanino siya nag-pair? Kay bicarb. So that makes it metabolic acidosis. And when you look at the partial pressure of carbon dioxide, guys, is it becoming alkalinic? Less than 35. Kung nauubos ang acidic content ng katawan, nagiging alkalinic. So, ibig sabihin, guys, nagko-compensate ba? Yes. And partially compensated, bakit? Is the pH normal or not normal? Not normal. That's why you get a partially compensated metabolic acidosis. Correct? Yes. Next, number 3. Yan Fei, a street vendor, is brought to the ER after falling and injuring her leg. She is tachycardic and tachypnic. After analgesics are given, she's developed muscle cramps, tingling, and paresthesia. ABG, your pH is 7.6. The partial pressure of oxygen is 120. The partial pressure of carbon dioxide is 31. And the bicarbonate is 25. What does this indicate? Guys, tignan mo ang pH, 7.6. Is that acidic or alka? Siyempre, the pH is alka. Now, tingnan mo ang kanyang carbon dioxide, 31. Is that acidic or alka? That looks like alka. Tama? Partial pressure of carbon dioxide, alka din, guys. So, may partner na ba tayo dito? Yes. So, that gives you, ang carbon dioxide is that metabolic or respiratory? Respire because it's gas. Correct? Carbon dioxide is gas. So, guys, ang best answer is you get a respiratory alkalosis. So, yan, ang alpha. Yan ang correct answer. And why uncompensated? Tingnan mo ngayon ang kanyang bicarbonate. The one that should compensate with the carbon dioxide abnormality. Guys, ang bicarbonate mo, guys, 25. Ang normal range is 22 to 26. So, 25, that's normal. Correct? Normal, guys. So, ibig sabihin, wala siyang pake. Hindi siya nag-compensate. Wala siyang pake. That's why uncompensated by your bicarbonate ion. Wala siyang pake. Kaya, the best answer is alpha, respiratory alkalosis. uncompensated. And look at the pH. The pH is not within the normal range, which makes it further uncompensated. Malinaw? Yes. Next, number 4. Shangling's grandmother has been vomiting for 2 days, appears weak and lethargic with dry mucosa and pure capillary refill. She's diagnosed with gastroenteritis and dehydration. ABG values: pH 7.5, partial pressure of oxygen is 85, partial pressure of carbon dioxide is 40, and the bicarbonate is 34. What imbalance is present? Guys, first, let's look at the pH, 7.5. That looks like, pH, alam mo na yan, alka yan. Kasi that's more than 7.45. Guys, ang iyong carbon dioxide, 40. Guys, is that normal? Kasi 35 to 45 ang range ng partial pressure of our carbon dioxide. Yes, guys, normal ang carbon dioxide mo. The next thing we look at is the bicarb, 34. Guys, ang bicarb mo, since tumataas, that means it's alkalosis, correct? Because the normal range is 22 to 26. Guys, ano to? This is, bicarbonate is metabolic in nature and you have an alkalosis pairing. So guys, this is metabolic alkalosis. Now, when you have a normal carbon dioxide that should compensate, walang pake, you get an uncompensated one. That's Charlie, metabolic alkalosis, uncompensated. Malinaw? Yes, because you have a normal carbon dioxide and an abnormal pH. Malinaw? Yes. Next, number 5. Nurse Barbara administers morphine IV to Lisa in the PACU for 2 hours after surgery. Lisa is difficult to arouse, has shallow breathing at 7 breaths per minute, and is unresponsive. ABG results, you have a pH of 7.10, a partial pressure of carbon dioxide of 70, and your bicarb is 24. What does this reflect? Guys, ayan na, pH is 7.10, that's acidic. Tama? Yes. And you look at the carbon dioxide, 70, is that acidic? Yes, so partial pressure of carbon dioxide, also acidic. Now, you have a pair. Ayan. Guys, ang next na titingnan mo is ang bicarbonate. 24, is that normal? Yes. So, Ca, ayan. It's normal. So guys, this is respiratory acidosis. That's bravo. Siya lang ang respiratory acidosis dyan. Uncompensated because walang pake ang iyong bicarbonate na dapat mag-compensate. Okay? And the pH is not normal, 7.10, as opposed to the normal range, 7.35 to 7.45. Malinaw? Yes, that's why bravo is the best answer. Next, number 6. Baby Kiki is brought to the ER by her mother, Ganyu, reporting 3 days of diarrhea, poor feeding, and irritability. Her fontanelles are sunken and the RR elevated. EBG is 7.39 ang pH. Ang partial pressure of carbon dioxide is 27. And then, ang iyong bicarbonate is 19. What is your interpretation? Guys, look at the pH first. 7.39. Is that acidic or alka? Within the normal range, correct? Yes. But 39 is that slightly acidic. Yes. Guys, so, tinan mo, ang pH niya, guys, it's normal, but it's slightly acidic. Paano natin nasabi na slightly acidic yan? Ang pinaka-normal talaga is 7.40. So, ibig sabihin, less than 7.40, slightly acidic, but still within the normal range. So, lalagay ko, normal, but slightly acidic. Guys, tingnan mo ang kanyang carbon dioxide. 27. Guys, ano nangyari sa carbon dioxide natin? Naubos. So, ito, ano yan? That's your alkalinic. Because carbon dioxide is acidic in nature. Losing the carbon dioxide means you're getting alkalinic. The normal is 35 to 45. Malinaw, 27 is less than 35. Alkalinic yan. Guys, your bicarbonate, 19. So, guys, ang bicarbonate mo, 19. Ano yan? Nagiging acidic ka. Correct? Yes. So, acidic yan, guys, ang bicarb mo. Ayun, may pair tayo, guys. Normal nga ang pH, but slightly acidic because it's 7.39. Correct? Yes. So, guys, that's your metabolic acidosis na fully compensated. Correct? Yes. Why fully compensated, ma'am? And why is it that the answer is Charlie, fully compensated metabolic acidosis. Metabolic acidosis kasi ang partner niya, metabolic in nature. Your bicarbonate. Malinaw? Yes, and they are both acidic. Guys, fully compensated because you have a pH that is normal and you have a carbon dioxide that is opposite of the metabolic abnormality, which is acidosis. Carbon dioxide tries to be alkalinic. So, trying to compensate. Kaya na-achieve niya ang normal na pH. Correct? So, that's why you call it a fully compensated metabolic acidosis. Malinaw? Yes. Next, let's go number 7. Toma has a nasogastric tube post-abdominal surgery, draining 900 cc of coffee ground secretions in 2 hours. He is disoriented and ABG shows pH of 7.57. Your partial pressure of carbon dioxide at 37 and your bicarbonate at 30. What is your assessment? Guys, first, let's look at the pH. 7.57. Acid or alka? pH, that's alka. Malinaw? Yes. Guys, carbon dioxide is 37. Normal? Yes. Oh, edi normal. Ayan. So guys, normal kasi the normal range is 35 to 45. 37 falls within that range. And look at the bicarbonate, guys. 30. O acid or alka? That looks like alkalosis. Malinaw? Yes. So bicarb mo, guys, edi alka. Ayun, you have a pair. pH and your bicarbonate, kaya metabolic alkalosis. O, saan dyan ang metabolic alkalosis mo? And then the partial pressure of carbon dioxide is normal, edi uncompensated. So metabolic alkalosis uncompensated, bravo, that's the best answer. Why? Your pH is abnormal. 7.57. And walang pake si carbon dioxide kasi normal siya. Hindi siya nag-compensate. That's why uncompensated. Malinaw? Yes. Next, number 8. Chongyun is scheduled for brain surgery and is very anxious. He begins hyperventilating and loses consciousness. ABG shows pH is 7.61. Partial pressure of carbon dioxide is 22. And your bicarbonate is 25. What's the ABG interpretation? Guys, first, let's look at the pH, 7.61. That looks like alka. Tama? Yes, kasi it's more than 7.45. The next thing we look at is the partial pressure of carbon dioxide, which is 22. Guys, nauubos ang acidic content ng katawan mo, which is the carbon dioxide. Ano yan? That's alka. Tama? Yes, now you have a pair that looks like respiratory alkalosis. Malinaw? Next, tingnan natin ang kanyang bicarbonate, 25. Guys, ang bicarbonate niya, 25, that's within the normal range. Okay, so wala siyang pake sa nangyayari. This looks like respiratory alkalosis na uncompensated. That's why the best answer is no other than Charlie. And guys, tatandaan mo, pag nakita mo yan, hyperventilating. Ibig sabihin, guys, nauubos ang carbon dioxide kasi hyperventilate. When you translate that, ventilation in the body is all about oxygen. So guys, opposite yun sila lagi, di ba? So guys, pag nakikita mo yan, hyperventilate, ibig sabihin yan, hyperoxygenate. So guys, pag masyadong maraming oxygen sa katawan, carbon dioxide also goes down. Kaya guys, alkalinic ang nangyari sa kanya. And what nature? Respiratory. Kasi sa breathing ang problem. So respiratory problem. Ano yan? Alkalinic. Kasi nawawala ang carbon dioxide kasi ikaw nag-hyperventilate or hyperoxygenate. So mataas ang oxygen, mababa ang carbon dioxide. So gets mo? Ayan. Pag nakita mo ang hyperventilating and then asking you of an ABG abnormality, it's gonna be respiratory alkalosis. Malinaw? Yes. And now you have a normal bicarb, di uncompensated kasi wala siyang pake. Hindi siya nag-compensate. Next, number 9. Sayu, age 3, is admitted for asthma and respiratory distress. Her mother, Ayaka, reports tremors and mood changes for 4 days. ABG, 7.35. Partial pressure of carbon dioxide, 72. And your bicarbonate is 38. What does this show? First, we look at the pH. Guys, the pH, that looks like normal but slightly acidic. Correct? Kasi ang normal, 7.40. So, 7.35 to 7.39, even if it's within the range of the normal pH, that's slightly acidic. Kaya nilagay ko dyan, normal, slightly acidic. The next thing we look at is the carbon dioxide. Sobrang taas, guys, ang partial pressure of carbon dioxide mo. That's acidosis. Now, you have a pair, okay? Your pH with your respi content, your carbon dioxide. So, you have respiratory acidosis. Now, let's look at the bicarbonate. 38. So, meaning guys, ang bicarbonate mo guys, 38, nagiging alkalinic because the normal range is 22 to 26. Now, you have an alkalinic bicarbonate ion. That's why guys, ang pH mo normal kasi may nagko-compensate becoming alkalinic and that's your bicarb. That's why this one is respiratory acidosis na fully compensated because you have a normal pH na slightly acidic lang but within the normal range of 7.35 to 7.45. And your alkalinic content in the body, which is your bicarb, is increasing to compensate. So that's fully compensated because you're within the normal range of your pH. Malinaw? Yes. Number 10. At a party, Rosaria falls while drinking and becomes unconscious with shallow breathing and bilateral ear bleeding. What acid-base imbalance is she at risk for? A. Metabolic acidosis, B. Metabolic alkalosis, or C. Respiratory acidosis, or D. Respiratory alkalosis. Guys, the only correct answer is no other than your respiratory acidosis. I'll give you a technique pag walang range na binibigay sa inyo or walang values. Like this one, walang values. You look at the cues. Guys, tingnan mo anong problem dito. Shallow breathing. Yan ang pinakaunang pinakita. Guys, shallow breathing is that respiratory in nature. Yes, kaya eliminate mo na lahat ng nagsasabi ng metabolic. Kasi respiratory in nature yan. Sabi, shallow breathing. Ibig sabihin, mababaw ang paghinga ni Rosaria. Guys, pag mababaw ang paghinga niya, guys, ibig sabihin, guys, hypoventilate. Anong sabi natin kanina? Ventilate, that's as equal as oxygenate. Correct? So, hypo, oxygen. Sinong tataas? Siyempre, the opposite one, your carbon dioxide. So guys, carbon dioxide, is that respi also in nature? Yes, that's why respiratory ang tinitingnan natin. And guys, pag tumataas ang carbon dioxide, is that acidotic in nature? Yes. Sino ang alkalinic? Si oxygen ang laging alka guys. Carbon dioxide, lagi talaga yan acidic. Kaya ang answer natin, respiratory acidosis. Malinaw ba? Yes. Okay? And it's never gonna be alkalosis kasi ang tumataas, carbon dioxide because of shallow breathing. Malinaw? Yes. Next. Number 11. Coley, 6-year-old, is brought in for vomiting, nausea, and weakness. Labs show potassium of 2.9 mEq. What imbalance is likely without intervention? Guys, is it respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis? Ito na, walang nabanggit anything about the breathing pattern of the patient. Safely eliminate alpha and bravo. Now, you have vomiting as a sign. Guys, when you are vomiting, are you losing the hydrochloric acid of the body? Yes, along with your potassium. Kaya meron siyang hypokalemia. That's why the best answer is no other than delta, metabolic alkalosis. Guys, natandaan mo yon? Sabi ko, when you are losing your HCl acid or your hydrochloric acid pababa, that's gonna give you an alka. Kasi acidic ba? HCl acid, acid. Ayan, acid, okay? Hydrochloric acid, acidic yan. So, pag suka ka ng suka, vomiting, nawawala ang acid ng katawan. And that's gonna give you alkalosis. And ano pa guys, meron kang potassium na bumababa, correct? E di alkalosis din yan. When you have too much, on the other hand naman, pag tumaas naman ng HCl acid ng katawan mo, hydrochloric acid, and ang potassium ng katawan mo, that's gonna give you acidosis. Okay? So, dito nauubos ang potassium mo, alkalosis. Kasi ano nangyayari sa'yo? Suka ka ng suka. Likewise, nauubos din ng hydrochloric acid, the acid content of the stomach, kapag ikaw ay nagva-vomit. Kaya, sa makatuwid, metabolic alkalosis. Kasi guys, ang pagsuka, metabolic in nature yan. Ang respy lang is ang breathing mo, carbon dioxide and oxygen. The rest is metabolic problem na. Malinaw? Yes, that's why the best answer, delta. Next, number 12. Lumin's mother is admitted after taking multiple aspirin tablets. She's complaining of reduced urine output and the nurse observes deep respirations at 32. What imbalance is she at risk for? Guys, the only correct answer here is no other than metabolic acidosis. Ang nangyari sa nanay ni Lumin, nag-swallow ng maraming aspirin tablets. And guys, reduced urine output. The mother is having deep respirations at 32. That looks like blowing off carbon dioxide. Tama? Yes. So, ang ginagawa dito, tinatanggal niya ang carbon dioxide. Di ba? Compensation to what? The ingestion of the aspirin and the kidney unable to balance out the acid-base imbalances kasi nag-reduce nga ang urine output. So, hindi nagpa-function ang kidney. So, pag may problema sa kidneys, hindi ka nakakaihi, gawa nga ng reduced urine output. So, ibig sabihin, bumaba ang kidney functions. Ano yan, guys? Sino magko-compensate? Respiratory mo. So, guys, ang ginagawa ng respy mo, tignan mo, oh, deep respirations at 32. That looks like trying to blow off carbon dioxide. Similar to what? Cosmos, correct? Yeah, cosmos respiration. So that happens if you want to compensate to what problem? Metabolic acidosis. Kaya the answer, imbalance she is at risk for, is metabolic acidosis. Malinaw? Yes. And guys, remember, in your kidneys, guys, dito natin minamanage ang iyong bicarbonate, HCO3. Diyan yan si bicarbonate minamanage. So, if ang kidneys mo nag-reduce ang function, gawa nga ng sign na to, reduced urine output, gives you the hint that the kidneys are failing or bumababa ang kidney function mo. So, kung bumababa ang kidney function mo, guys, bababa din ang bicarb sa katawan mo. And bicarb, in and of itself, is alkalinic. Tama? Yes. So, kung nauubos ang alka ng katawan, nagiging acidic. And kidneys, ano yan? Metabolic or respy? Metabolic, correct? Yes. That's why the only correct answer is Charlie, metabolic acidosis. Malinaw ba? Yes. Next, number 13. After a car crash, Bennett is found disoriented and hyperventilating. 32 breaths per minute with tingling fingers. What imbalance is he at risk for? Ayan na guys. Diba sabi natin, hyperventilating is just the same as or synonymous to hyperoxygenating. So, anong bumabagsak? Carbon dioxide. Ano to? Di, since we're talking about gases, we're talking about the breathing, edi respiratory yan, eliminate all metabolic, and then you have a low carbon dioxide and high oxygen, edi that's alkalosis. Respiratory alkalosis. Malinaw ba? Because oxygen will always be alka and carbon dioxide will always be acid. Tama? Yes. That's why the best answer is bravo. Next, let's look at number 14. Following GI aspiration during surgery, ABG values of cyno are pH 7.55, partial pressure of carbon dioxide is 52, and your bicarbonate is 40. What is the likely disorder? Guys, first, let's look at the pH. 7.55, that means the pH is alkalinic because the normal range is 7.35 to 7.45. Now, let's look at the carbon dioxide. 52. Guys, ang carbon dioxide ng katawan niya, PaCO2, that's becoming acidic, correct? Because that's more than 45 and the normal range is 35 to 45 for the partial pressure of carbon dioxide. Now, in the bicarbonate, you have 40. Guys, ang bicarb ng katawan mo, nagiging alka because the normal range is 22 to 26. Higher than 26, alkalinic yan because bicarb is alkalinic in nature. You have a pair. Your pH is paired with the bicarbonate. That's metabolic in nature na ano? Alkalosis. So guys, metabolic alkalosis, walang iba kundi delta. Okay? And guys, acidic ang iyong partial pressure of carbon dioxide, ibig sabihin may compensation. But since the pH is abnormal, that means this is just partially compensated. Ayan. So the best answer is delta. Next, number 15. A young woman, Yalan, is found comatose from sleeping pill overdose. ABG, pH is 6.90, guys. Ayan na. Your bicarb is 13, and then your partial pressure of carbon dioxide is 68. Her acid-base status is A, metabolic acidosis, B, respiratory acidosis, or C, simultaneous respiratory and metabolic acidosis, or delta, respiratory acidosis with complete renal compensation. Guys, anong best answer dito? Una, tignan natin ang pH, 6.90. Oh, guys, malinaw na malinaw. That's acidosis, less than 7.35. Lower pH gives you an acidic environment. Next, let's look at the bicarb. Guys, ang bicarb mo is 13. Acidic ba yan? Yes, kasi bicarbonate ion is naturally alkalinic. The normal range is 22 to 26. So when you are losing the alkalinic compound of the body, that's giving an acidic environment. Okay, it's giving acidity. So next is the carbon dioxide, 68. Guys, ikaw na mag-isip. Carbon dioxide, 68, that's acidic. Acidotic yan. The normal is just 35 to 45. More than that, kasi carbon dioxide is normally acidic talaga in nature. So higher than 45, an increase in the value of an acidic compound such as your carbon dioxide gives you an acidic content. Ma'am, ano tawag mo dyan? Tatlo sila, acidic lahat. Edi guys, that's no other than your C, simultaneous respiratory and metabolic acidosis. That can happen to a person. Wala nang compensation na nangyayari. Kasi ano ba nangyari sa young woman na to? Guys, nag-overdose ng sleeping pill. Tapos comatose na. Ibig sabihin, hindi na nakakompensate ang katawan. Okay? Close to death na to. Okay? So guys, that's the best answer, Charlie. Simultaneous respi and metabolic acidosis. You have the three values of an acidic content. Next one, number 16. Catching arrives at the ER with fever and chills, temperature of 100 degrees Fahrenheit, the RR is 20 and deep. The ABG values, you have pH 7.37, the partial pressure of oxygen is 90, the partial pressure of carbon dioxide is 40, and the partial pressure, and the bicarbonate is 24. Your interpretation, A, hyperthermia, B, hyperthermia with respiratory alkalosis, or C, hypothermia, or delta, hypothermia and respiratory alkalosis. Guys, the only correct answer is alpha. Hyperthermia lang yan. Kasi temperature of 100 degrees Fahrenheit. Bakit? Una, titingnan mo ang pH, 7.37. Guys, that pH is normal even if it's slightly acidic. Correct? Yes. Now, let's look at the carbon dioxide, 40. Guys, ang carbon dioxide, pag 40 yan, that's normal kasi the normal is 35 to 45. 40 is within the normal range. Next, you look at the bicarbonate, HCO3. Bicarbonate is 24. The normal is 22 to 26. Di that's normal. Guys, normal lahat. Di anong meron ka? Temperature of 100 degrees Fahrenheit, that's about 37.7 degrees Celsius. Guys, is that warm? Elevated ba yan? Yes. Kaya ang only answer, hyperthermia. You don't have any problem when it comes to the ABG values of the patient. That's why it's giving hyperthermia. Okay? No more, no less. Next, number 17. A 16-year-old primigravida named Noel, who had attended only one prenatal checkup, is admitted in active labor at 37 weeks. Her cervix is 7 cms dilated, with the presenting part at station 0. When brought to the labor unit, she appears anxious and is hyperventilating. Ayan na guys. Due to hyperventilation, the nurse should assess Noel for what? O guys, alam mo na to, pag nag-hyperventilate, edi nag-hyperoxygenate. Nauubos ang carbon dioxide kasi tumataas ang oxygen. Hyperventilation is equals to hyperoxygenation. Edi ang problem mo is respiratory in nature, alkalinic, alkalosis. So respiratory alkalosis is the only correct answer. It's not gonna be metabolic because that problem, hyperventilation, is lungs in nature. Gases ang problema. That's why respi ang sagot. Now, hyperventilation, again, hyperoxygenation. Oxygen is alkalinic in nature, respi alkalosis. Malinaw? Yes. Next, number 18. The nurse is caring for Coley, who had been experiencing severe diarrhea. Which acid-base imbalances should the nurse assess for? A. Respiratory acidosis, B. Respiratory alkalosis, or C. Metabolic acidosis, or delta metabolic alkalosis. Guys, since si Coley nagda-diarrhea, guys, eliminate mo na lahat ng respi. Okay? Diarrhea, metabolic in nature. It has nothing to do with the lungs. So, eliminate respi choices. Guys, pag ikaw nagtatae-tae in your ass, and you get an acidosis. Charlie is the best answer. Metabolic acidosis because diarrhea is in the ass. Okay? Yes, that's the best answer. Charlie. C is the best answer. Next, number 19. Yunjin becomes increasingly restless. Her ABG results show pH of 7.52, partial pressure of carbon dioxide at 38, your bicarbonate at 34. The nurse should base care on which acid-base imbalance. Guys, first, let's look at the pH. Walang kamatayang looking at the pH. 7.54, guys. Edi, ang pH ng pasyente mo, alkalinic. Because it's more than 7.45. The normal range is 7.35 to 7.45. This is how you memorize it. You repeat it again and again and again. Okay? Yes. And the next one, you look at the carbon dioxide. 38. Guys, your partial pressure of carbon dioxide, since it's 38, that's normal. Because the normal range is 35 to 45. Correct? Yes. Now, let's look at the bicarbonate. Guys, ang bicarbonate ng pasyente mo, 34. That's alka. Alka. Because the normal range is 22 to 26. Tumataas ang bicarb, mas nagiging alkalinic because bicarb is alkalinic in nature. Okay? Guys, ayan, may pair ka na. Edi, you have your metabolic alkalosis. O guys, edi metabolic alkalosis, delta is the best answer. And since you have a carbon dioxide na walang pake, hindi nag-compensate, uncompensated. Hence, the pH is not normal because the carbon dioxide does not compensate. So guys, it's metabolic acidosis, uncompensated. Malinaw? Yes. Next, number 20. Tignari reports a dull headache and dizziness with an elevated pulse rate. ABG results, ang pH 7.26. Ang partial pressure ng carbon dioxide 50. Ang yung bicarbonate 24. These lab values indicate, guys, first, let's look at the pH. 7.26. Oh guys, the pH, that's literally acidic because the normal range is 7.35 to 7.45. 7.26 is less. So lower pH, more acidic. Correct? Yes. Next, let's look at the partial pressure of carbon dioxide. Guys, the partial pressure of your carbon dioxide is 50. That's acidic because the normal range is 35 to 45. Okay? Guys, and carbon dioxide is normally acidic in nature. So guys, may partner ka na ba? Yes. And carbon dioxide, is that a gas? Yes. Therefore, this is your respiratory acidosis. The next thing you look at is your bicarbonate. Guys, 24. Meaning, ang bicarbonate mo, guys, walang pake. Meaning, normal. Guys, what's the normal range? 22 to 26. So, pag 24 siya, normal siya, wala siyang pake, this is your respiratory acidosis na uncompensated. So, the best answer is bravo. And ano yan, guys? Uncompensated. Malinaw? Yes. Okay, so that's the best and only answer. Next, let's look at number 21. What is appropriate nursing care for Nilu who is diagnosed with metabolic alkalosis? A. Monitor serum potassium levels. Or B. Maintain the client on bed rest. Or C. Have the client inhale carbon dioxide using a paper bag. Or Delta. Administer sodium bicarbonate as ordered. The only correct answer for number 21 is no other than you monitor serum potassium levels. Why? Remember kanina sabi ko, guys, when you are losing your potassium, you are becoming alkalinic. And potassium is metabolic in nature kasi ang respi mo lang is ang gases mo. carbon dioxide and oxygen. So the rest, no matter what they are, metabolic yan. Malinaw? So si potassium, guys, when you're losing potassium, you're getting alkalosis. When you're gaining a lot of potassium, you're gaining acidosis because potassium is acidic in nature. Malinaw? Yes. Guys, monitor serum potassium level because pag alkalinic yan, bababa ang potassium mo. Okay? That's why alpha is the best answer. And hypokalemia, it's dangerous for the cardiac muscles. Correct? Yes. Guys, maintain the client on bed rest, hindi kailangan. That will not solve the problem of the acid-base imbalance. Next, have the client inhale carbon dioxide using a paper bag. You don't do this management, gagawin mo lang yan kapag nag-hyperventilate ang pasyente mo. If the problem is respiratory in nature. This one, metabolic alkalosis. Sinabi na sa'yo straight up, metabolic alkalosis. So guys, you deal with the problem of metabolic alkalosis. This one, inhaling in a paper bag, that's what you do as a management for hyperventilation, malinaw, to recycle carbon dioxide to prevent respiratory alkalosis and not metabolic alkalosis, which is the problem of your patient here. And delta, administer sodium bicarbonate. Guys, bicarbonate like your HCO3. Bicarbonate, ibibigay mo yan pag meron kang acidosis. Malinaw? Yes, ano to? Metabolic alkalosis. So you don't give sodium bicarbonate. You don't give it. You only give it for metabolic acidosis. For metabolic acidosis lang yan, guys. That's the drug of choice for metabolic acidosis. So you don't give it to the opposite one, which is alkalinic. Alkalosis to. Okay? That's why the best answer is alpha. Next, number 22. The nurse reviews ABG results of Zhongli, who has chronic obstructive pulmonary disease, a pH of 7.35, a partial pressure of carbon dioxide of 62, and then a partial pressure of oxygen of 70, your bicarbonate at 34. The nurse should A. Apply a 100% non-rebreather mask, or B. Assess the vital signs, or C. Reposition the client, or D. Prepare for intubation. The first thing we look at is the pH. Guys, 7.35, is that normal? Yes. Slightly acidic? Yes, kasi ang pinaka-normal, 7.40. The range of normal pH is 7.35 to 7.45. So this one, normal pH, just slightly acidic. Next, we look at the carbon dioxide. Guys, 62 ang partial pressure of the carbon dioxide. Di ibig sabihin yan, acidic ba? Yes, because the normal range is 35 to 45. Guys, the next thing we look at is the bicarbonate. Ang bicarbonate ng pasyente mo, guys, 34. Is that alka or acid? Guys, alkalinic yan. Kasi the normal range of your bicarbonate is 22 to 26. And bicarbonate is alkalinic in nature. Increasing number of the bicarb, ibig sabihin mas nagiging alkalinic siya. So now guys, meron ka dito guys, pair of your pH and your carbon dioxide. And the respiratory acid. Pero guys, since normal ang pH and alka or opposite ang iyong bicarbonate, that's your fully compensated. Guys, kung rest by acid and fully compensated, kailangan mo mag-intubate? No. And since this is chronic obstructive pulmonary disease, COPD, you don't put an NRM. Dapat dyan, you maintain the hypoxic drive. So, nasal cannula, 1 to 2 liters per minute. Okay? And there's no need to reposition the client. That's why the only best answer is to assess the vital signs. Tignan mo pa, more further assessment needed so that you can see if may problems pa ba ang pasyente mo. Kasi based sa ABG niya guys, meron siyang respy acid na fully compensated naman. And true enough, do you really expect that on patients with chronic obstructive pulmonary disease? Yes. Tataas ba talaga ang partial pressure of carbon dioxide because they have the tendency to trap the air inside their alveoli? Yes, correct? Kaya nga meron tayong tinatawag na hypoxic drive to breathe. Mataas talaga ang carbon dioxide sa katawan ng pasyenteng may chronic obstructive pulmonary disease. Ang importante, you're able to compensate. Hence, you have a fully compensated respiacidosis here. So there's no need to do any intervention. The thing you do is to assess the vital signs and see if there are any aberrations or abnormalities for you to manage as a nurse. Malinaw ba? Yes. Next, number 23. Faruzan is experiencing persistent vomiting. The nurse knows that this client is at risk for metabolic alkalosis and should specifically assess for A. Irritability, B. Hyperventilation, C. Diarrhea, or D. Edema. Oh guys, the only correct answer here, if you are persistently vomiting, you check the patient for irritability as a result of the metabolic alkalosis problem of the patient. It's not gonna be hyperventilation kasi this is not respy in nature. Vomiting, that's metabolic in nature. And definitely not diarrhea kasi nagva-vomit na nga, di ba? And not edema, walang relate. So the only correct answer is irritability, gawa nga ng metabolic alkalosis. Kasi that one, it can decrease your potassium. Remember? Yes. And potassium, that's also an electrolyte important for proper brain functioning and muscle coordination. So, alpha is the best answer, irritability. Next, number 24. Candice appears flushed and breathing shallowly. ABG results show pH of 7.24, partial pressure of carbon dioxide at 49, and your bicarb at 24. These findings are indicative of, guys, the first thing you look at is what? The pH, 7.34. So, ang pH ng pasyente mo, acidic. Correct? Yes, because the normal range is 7.35 to 7.45. Less than that, acidity. So yan, guys, acidosis, 7.24 is acidotic. Next, you look at the carbon dioxide. Guys, the partial pressure of carbon dioxide of your patient is 49. What's the normal range? 35 to 45. 49 is that acidic. Correct. So guys, may pair na ba tayo? Yes. So guys, carbon dioxide is that respiratory in nature. Yes. So you have your respiratory what? Acidosis. That's why the best answer is Charlie. Now, tingnan mo ang bicarb niya, 24. Guys, and if ang bicarb mo is 24, is that normal? Yes, because the normal range is 22 to 26. So guys, normal yan. That's respiratory acidosis uncompensated. Kasi walang pake ang bicarb mo, hindi nag-compensate, kaya ang pH mo, 7.24, still not within the normal range of 7.35 to 7.45. Malinaw ba? Yes. Next. Number 25. ABG values of Cave are pH 7.31, partial pressure of oxygen is 80, partial pressure of carbon dioxide is 65, and your bicarbonate is 36. The nurse should assess the client for what? Oh guys, the first thing you look at is the pH. Ang pH ng pasyente mo, 7.31. Guys, is that normal or acidic? The pH is acidic because the normal range is 7.35 to 7.45. Next, look at the carbon dioxide, 65. Guys, is that acid or alka? The carbon dioxide of the patient is acid because the normal range is 35 to 45. And then the bicarb of the patient is 36. Guys, ano yan? That's, guys, nagko-compensate, nagiging alkalinic siya. Because the normal range of your bicarbonate is no other than 22 to 26. Malinaw ba? Yes. So guys, ang problem dito, the nurse should assess the client for what? You have respiratory acidosis na compensated lang. Partially compensated because the pH is still abnormal. So, partially compensated lang yan. At least nag-compensate kasi nagiging alka ang iyong bicarbonate. The opposite of your acidosis. Correct? So, may compensation pero partial lang because the pH is not normal. It's abnormal, 7.31. So, what are you looking for? Since ito is compensated naman, guys, since this is a partially compensated respiratory acidosis, you are going to look for a flushed skin. Guys, cyanosis yan kapag uncompensated respiratory acidosis. Kasi remember yung sinabi natin kanina, if tumataas ang oxygen, edi bumababa ang carbon dioxide. Anong nangyayari dito? tumataas ang carbon dioxide. So, the opposite is also true. Pag tumataas ang carbon dioxide, guys, ang nangyayari sa oxygen, nauubos siya. That's the one, pag uncompensated, can produce cyanosis. So, the best answer is flushed skin lang. Irritability, saan natin makikita yan? Kapag bumababa ang potassium in your metabolic alkalosis. Correct? Yes. And anxiety, saan mo makikita yan, guys? Anxiety, hyperventilation. Correct? Mag-hyperventilate ka pag nag-anxiety ka. E di ano yan? That's your alka. Correct? Kasi hyperventilation is hyperoxygenation. Mataas ang oxygen, mababa ang carbon dioxide. Ayan. So, ano yan? Alka. That's anxiety effect, your alka. That's why the only best answer is flushed skin. Kasi meron kang respiratory acidosis. Pero partially compensated naman. Malinaw ba? Yes. Next, number 26. Ito is having a severe asthma attack. His ABG results are pH of 7.33, partial pressure of carbon dioxide 48, partial pressure of oxygen at 58, and the bicarb at 26. Which order should the nurse prioritize? Guys, first, let's look at the pH. 7.33. The pH is acidic. Now, let's look at the carbon dioxide. Guys, 48. The partial pressure of carbon dioxide, guys, that's also acidic because the normal range is 35 to 45. And in your pH, the normal range is 7.35 to 7.45. Now, let's look at the bicarb, 26. Guys, ang bicarb mo guys, 26. Walang pake. Is that normal? Yes. So, you have respiratory acidosis na uncompensated. Anong nangyayari guys? Tumataas ba ang carbon dioxide? Yes, kasi 48 from the usual range of 35 to 45. Anong gagawin mo pag may respiratory acidosis ka na uncompensated? Meaning, you're accumulating a lot of carbon dioxide. You want to blow out the carbon dioxide para maging alkalinic ka, para mawala ang respiratory acidosis, para maubos ang carbon dioxide. For better ventilation, the only best answer is alpha, albuterol nebulizer. That one is a bronchodilator. So when you dilate the airways, you increase the oxygenation. That one can compensate with the respiratory acidosis. That one can reduce the partial pressure of carbon dioxide. Okay? You don't need to do chest x-ray or do your ipratropium inhaler or sputum culture. The first thing you do is to dilate the airways using your bronchodilators, and that's your albuterol. Malinaw ba? Yes. Next, number 27. ABG values. Next, number 27. ABG results of DEA show pH of 7.52, partial pressure of oxygen at 50, and the partial pressure of carbon dioxide at 28. And then your bicarbonate at 24. Based on the PaO2, eto na, sabi niya, tingnan mo ang partial pressure of oxygen. Which conclusion is most accurate? What's the partial pressure of oxygen, guys? 50. O, eto na, ang partial pressure ng oxygen, ang normal should be 75 to 100. If it's 50, it's less than 75. So, guys, that's acidosis kasi oxygen is alkalinic in nature. Anong gagawin mo? The only best answer is no other than alpha. The client is severely hypoxic. Hypoxic. From the word itself, hypoxic, hypo, ang oxic or ang oxygen niya, which is true. Kasi ano nangyari guys, the oxygen is, partial pressure of oxygen is 50 from the normal range of 75 to 100. That's why the only correct answer is alpha. Pag very hypoxic yan, you do not use a very low oxygen concentration. You need to increase that kasi very hypoxic siya, severely hypoxic. And the oxygen level is low but poses no risk is definitely not correct kasi 75 to 100 ang acceptable range. 50 is very low and definitely it's not within the normal range. Next, number 28. The ABG of Lila shows a pH of 52, partial pressure of oxygen at 50, and then the carbon dioxide at 28. And then the bicarb at 24. The nurse determines which possible cause of these findings. Guys, first let's look at the pH. 7.52, the pH, meaning this one is alkaline. alkalinic. Tama? Yes, alkalinic because the normal range is 7.35 to 7.45. 7.52 range meaning alkalinic yan. And then guys, you look at the carbon dioxide, 28. Guys, anong nangyari sa carbon dioxide mo? Which is the acidic gas of the body. Nawawala, nauubos, so nagiging alkalinic. Sinong partner? pH with your partial pressure of carbon dioxide. So you have Respialka to guys. Anong nangyayari sa iyong bicarbonate guys? 24, wala siyang pake. So guys, HCO3, 24 is normal. So you have respialka na uncompensated. And since it's uncompensated kasi walang pake ang iyong bicarb being normal because the normal range is 22 to 26. Eh di ang pH mo abnormal din, 7.52. So anong gagawin mo guys? What's the possible cause of this finding? The only correct answer for number 28, guys, is no other than a pulmonary embolus. Guys, bakit? Tingnan mo. In a chronic obstructive pulmonary disease, alkalosis ba? No, kasi meron kang hypoxic drive. The hypoxic drive in and of itself will tell you there's low oxygen and high carbon dioxide. Now, high carbon dioxide, it's not gonna give you an alka. It's gonna give you acid. So guys, this is respiratory acidosis. So eliminate mo na yan. In diabetic ketoacidosis, from that problem in and of itself, that's metabolic in nature. Okay, kaya may cosmos respiration. This is just compensation. But the problem is really the diabetic ketoacidosis. Ano yan? Edi metabolic acidosis yan. Tama? Yes, kasi diabetic is that metabolic in nature. Yes. And ketoacidosis, edi metabolic acidosis. And guys, myocardial infarction, guys, yan wala yang relate sa ABG abnormalities yo. A myocardial infarction will not yield any problems in the acid-base imbalances of the patient. That's why the only correct answer is your pulmonary embolus. When you have an embolus lodged in the pulmonary circulation. Guys, bakit? Tingnan mo, ang partial pressure ng oxygen niya, guys, 50 na lang. Anong normal niyan, guys? 75 to 100. So, hypoxic ba? Yes. At the same time, guys, ang carbon dioxide nauubos. Bumababa, nagiging 28 as opposed to the normal range na 35 to 45. Anong nagkakos niyan, guys? It's a clot or an embolus where in the pulmonary circulation. Kaya hindi maayos ang pag-control sa iyong carbon dioxide and oxygen. And ano ba yan? Respy in nature ba yan? Yes. So, nasa ng problem? Respiratory din ba? Yes. So, saan dyan ang may respiratory problem, guys? Na magbibigay ng respy alka? No other than your pulmonary embolism. Malinaw ba? Yes. That's why that's the best answer. Next, number 29. Mika is a primi-gravid in active labor. 2 fetal scalp blood samplings have been performed. The nurse knows fetal acidosis is indicated when the scalp blood pH is below. Ano guys? Asan dyan ang acidic guys? Oh, the only acidic pH there is no other than 7.2. Kasi guys, 7.4 pati 7.3, that's normal. And 7.5, that's already alka. The only acid here is 7.2. The lower the pH value, the more acidic it is. Correct? Yes. Next, number 30, last item. The nurse interprets which of the following as an early sign of ARDS in Jean who is at risk. ARDS, it's your acute respiratory distress syndrome. Guys, bakit ba ito nandito? Anyway, sagutin na lang natin. Guys, the only correct answer, guys, A, elevated carbon dioxide level, B, hypoxia not responsive to oxygen therapy, or C, metabolic acidosis, or D, severe unexplained electrolyte imbalance. Oh, the only correct answer is no other than delta. Guys, yan ang hallmark sign ng ARDS. Hallmark sign niya ng ARDS. Oh, put a star. Guys, when you say acute respy distress syndrome, ang syndrome na to guys, characterize yan siya pag refractory ka na to oxygen therapy. O, tandaan mo yung sinabi ko, refractory to O2 therapy. When you see the word refractory, Ibig sabihin, hindi na mabisa sa'yo, wala ng effect ang kahit anong oxygen therapy. Ibig sabihin, kahit i-intubate ka pa, guys, hindi na maayos ang oxygenation ng katawan mo. Refractory ka na to treatment. Hindi na mabisa ang kahit anong treatment sa'yo. That's precisely your ARDS, your hypoxia, not responsive to any oxygen therapy. That's the early sign of ARDS. And guys, tuloy-tuloy na yan. Since hindi ka responsive to the oxygenation therapy na binibigay sa'yo, nagiging hypoxic ka. And because you are hypoxic, the carbon dioxide will increase. Remember the opposite relationship of carbon dioxide and oxygen. Since hypoxic ka na unresponsive to oxygen, low oxygen will yield elevated carbon dioxide. So, sino pa rin ang early sign? The one that causes your alpha. So, it's hypoxia that is unresponsive to treatment that will give you later on an elevated carbon dioxide level. That's why the best answer is bravo. Metabolic acidosis is not related since this is respiratory in nature, since ARDS is directly on the lungs, correct? Yes, and definitely not about an electrolyte imbalance. Guys, you can connect that with what? A kidney problem. A severe unexplained electrolyte imbalance is a problem in the kidneys. Kasi your kidneys, that's the organ responsible to control the electrolyte concentrations of the body. So problems in the electrolyte, you look at the problems in the kidneys. That's why the only correct answer is bravo for number 30. Ayun lang, that's all. Hope you learned and this helped. Bye!